Hello, and welcome back to another episode of Straight Up with Steph. Today, we are talking all about tongues. And did you know that there's something called tongue mapping? I recently learned about it. But once we start to understand tongue mapping and the different areas of the tongue and how they correspond to different areas of the body, we can really open up conversations with our patients that maybe we haven't had before. And today, I've got an expert in tongue mapping. She's a dental hygienist and she's passionate about the oral systemic link. And she is really a specialist, at least in my eyes, in tongue mapping. I've been practicing for a while now, almost 17 years, and I can say no two tongues are the same. We've all seen it, all kinds of variations with the tongue, the size, the shape, the color, the thickness. Maybe they're coated. Even the tongue coatings are all different colors and thicknesses. Maybe we see fissured tongue or geographic tongue. And over the years, I've noticed all of these things, but I haven't known enough to really open up these conversations with patients. And today, Lani shares not only what tongue mapping is, but also these different areas of the tongue that we can look at that might indicate some kind of imbalance in specific organ systems in the body, which is really cool. And she shares some stories too on patients where she's noticed something, they followed up with their healthcare clinician, and they've come back with something that she thought might be going on because of just what she saw on the tongue. And we all, as dental clinicians, want to be seen as healthcare providers, not just tooth drillers or not just tooth scrapers. And really, it's conversations like these that are going to elevate us in the eyes of our patients that we are healthcare clinicians. This was a really fun conversation on something that I don't know a whole lot about from a very nice and smart hygienist. I hope you enjoy today's conversation all about tongues with Lani McBeth. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Lani. I have been looking forward to this conversation. I know we had to reschedule because I was sick, but I have been seriously just counting the days till I got to talk to you about this. So thanks for joining.
Oh, I'm excited to be here. It's always exciting to bring a new innovative thought process to our profession. And this is a conversation that actually opens that door wide open. So I'm excited to be here. Thanks for having me.
Yeah, of course. No, so there's not a lot of topics that I don't at least know a little bit about, but this one I don't. So I'm just excited to learn. And I know that my listeners are going to get a lot out of this too. So, first off, what is tongue mapping and how did you get interested in it?
So I'll start with the second part of that, how I actually got interested in it. I got certified as a holistic hygienist through the International Academy of Biologic Dental Medicine about 3.5 years ago. And a part of that certification, you take coursework, and then they require you to either do a paper or a presentation or something of that nature to kind of finish out your certification. And in the coursework, there was just little blip in the education about Eastern medicine and the use of Chinese tongue mapping as a diagnostic tool. So I spent the next probably 8 months diving deep into the subject of Chinese tongue mapping. I actually refer to it for my patients as systemic tongue mapping because that's really what it is. And with systemic conversations actually happening, patients are far more receptive to that word frame. So anyway, I dug deep into it. I started reading, I started researching, I started looking at patients' tongues, and then I started having conversations. And I've been a hygienist for 39 years now and a life learner. And this has just taken me down a path to really improve patients' health. And when you dive deep into different subjects, it's really about being open-minded to the possibilities. And that's what this really is all about, is just being truly open-minded to what's happening in our environments. And every time I have a conversation with a patient about their tongues, they go, nobody's ever talked to me about my tongue like that. Our patients are interested. And COVID really opened doors of opportunity for us to have different conversations with our patients. So hopefully this will open some doors of interest for all of your listeners on the podcast as we dive deep into it today. It'll be fun to share what I've learned. So
Yeah, no, that's awesome. So I've been practicing for damn near 17 years. And whenever, and I do oral cancer screenings on all of my patients every time they come in. And I can say, I mean, no two tongues are alike. And I've always known there's just been this thought in the back of my head. I'm like, I know that there's more to the tongue. Like it's probably telling me a lot that I don't speak the language yet, you know? So what is tongue mapping?
Tongue mapping is really just taking the evidence that's on the tongue and really associating it what's actually happening in the patient's mouth. So I'll start by just saying that when you look at the tongue actually in Eastern medicine, like I said, it has a map to it. So the tip of the tongue is related to the area of the heart. Just behind it is related to the lungs. Down the center of it is related to the stomach, the spleen, the pancreatic health for a patient. And the distal third of the tongue is related to their intestinal, their bladder, and their kidney health. The borders of the tongue, the left side of the tongue is more related to the liver function for a patient, and the right side is more related to the gallbladder side. So when you're mapping the tongue into thirds, you can really look and see what's happening on those areas of the tongue. The most important thing is to understand that you look at the color of the tongue, the shape of the tongue, whether or not the coating is actually present and what the coating on the tongue actually looks like. And then whether or not there's moisture and fissuring on the tongue. So, one of the easiest things to really address is when you have patients that have coating on their tongue, are they brushing their tongue? Are they using a scraper? Are they aware that there's bacteria that's actually living on the tongue that is contributing to their overall health? Are you familiar with Barbara Tritz?
I know her and I know that she talks a lot about like biological dental hygiene and stuff. Yeah.
So she has a phase electron microscope. And so she uses that alongside her patients every day. Primarily in the past, she has looked at what type of bacteria is actually present in the plaque layer. And so I reached out to her and asked her if she would do me a favor and take some slides of the tongue. And the first one that she actually sent me, and it's a part of my 2 hour lecture, but was on a 9-year-old boy who was struggling with decay and just a lot of different things. And so she had done a slide of the plaque, and the plaque looked pretty benign, our normal bacterial flora, rods and cocci and stuff. Nothing really invasive, nothing really scary. And then she actually took a sample of his tongue. And in that particular sample, there were spirochetes. And as a 9-year-old, if we're not addressing the entire mouth as it relates to the bacterial flora, so the spirochetes had found an environment in the mouth that was supportive to be able to
Mhm.
grow and really invade, if you want to say it that way. And so we have to look at the tongue in that aspect as well, is that the coding actually tells us a lot about what's happening for a patient. So coating and dryness and the fissuring in our mouths are probably the two easiest things to really talk to patients about. Ironically, what we know through Eastern medicine and the way they look at systemic health is that how our body processes fluids and the coating on our tongue actually all comes from our stomach health. When we look at tongues, oftentimes you will find that the coating is really down the center of the tongue or to the distal third of the tongue. I don't know if when you've looked at tongues, you've gone, oh, there's something going on there. There's a lot of stuff on that tongue.
Yeah, and I'm like, I know that there's something going on, but I don't know what it is and I don't know what this means. But there has been like specific patterns too of that coating, or even it almost looks like not black hairy tongue, but white hairy tongue, but just like down the midline and not on the sides. Yeah, I feel like I've seen it all. I don't know what it means.
Yeah. So, probably the most common conversation that I have with patients is really about, are they brushing their tongue? And 90% of them will say, oh gosh, no. Some will say, oh, I use a tongue scraper. So here's my 10 cents on tongue scrapers. I like to say our tongues are like a gravel road. There's 4 different types of papillae that live on our tongues. So you're going to have peaks and you're going to have valleys. So when we think of construction equipment, when we have a really bumpy surface in the road, they take a scraper and they smooth out the top surface, right? But not long after that, those bumps come back because they haven't done anything to really restore the ground to make sure that it's more stable underneath so that the ground doesn't develop those ripples in it again. Well, that's kind of what we do when we scrape our tongue is we're smoothing out the top surface of the papillae. We're not necessarily getting into what I like to say is the valleys of the tongue. And so I brought this or set this aside, but this is one of my all-time favorite tools. It's called a tongue and it's a tongue brush. Here's a different color. You might be able to see it a little bit differently, but you
Okay.
can
Yeah.
see
Yeah,
that
I
the
can see it.
profile of it is much flatter than a normal, regular soft bristle toothbrush. And then I don't know if you can see it there, the face of it, you can see how the bristles are a little bit more spread out. It's about the size of our mirror. And what I have found when patients actually incorporate this into their daily routine is that it really helps to get into those crevices, the grooves, and helps to remove that bacteria on a more effective basis than just using a tongue scraper. Have you ever seen these brushes before?
No, I haven't actually.
This particular company is out of Montana. So they're a USA made product, and they now have a partnership with Henry Schein. So offices or practices can actually get these through Henry Schein, and they could probably ask their rep if they could get a sample of it. And I'm sure the owner of the company is very receptive to doing that kind of stuff. But in personally using it, what I have found is that first thing in the morning when I get up, if you look at your tongue first thing in the morning and you haven't done anything the night before, it's going to be heavily coated. And that morning breath that we have often comes from what's living on our tongues. And so by doing it on a nightly basis, just as a part of their oral routine, I never have coating on my tongue in the mornings anymore. So it's as simple as brushing our teeth every day. So that is probably one of the first things that I really talk about with patients. Geographic tongue. What do you think about geographic tongue?
I know that I have it and I've seen it with my patients and whenever I see it and they sometimes notice it too. They're like, "What is this?" I tell them it's benign, like nothing to worry about, don't worry about it, but do I know what's actually causing it? No, I don't.
So, yes, it's a benign migratory glossitis, but it's an inflammatory response. It's telling us that there's inflammation someplace in our body, right? And as we know, why it's called geographic tongue is because it migrates throughout the
Mhm.
regions of the tongue. So, I'm just going to share a story about a patient that I had. And it was one of my early patients that I really started talking about things. It was a patient that was very receptive. She was already seeing a functional medicine practitioner. So she was really trying to figure out what was going on health-wise. 34-year-old female, tall, thin, petite. And when I did my oral cancer screening and then I looked at her tongue and the back of her throat, she had a spot of geographic tongue right in the gallbladder region. And like I said, that's on the right side of the tongue. And I asked her, "Are you open to a conversation about what I'm seeing?" And I usually tell or ask that question because some people are receptive, other people
Yeah.
might not always be. Now, I've never had a patient say, "Well, no." And it really kind of piques their curiosity. It's a conversation that they've never had, right? As hygienists, we focus on brushing the teeth and flossing and talking about, their perio health and stuff. But tongue health really is a component to their overall health. And if we'll pay attention and start talking about it, then we help them become better advocates for themselves. So in this particular
Mhm.
patient, I saw this spot on her tongue. I shared with her what I knew about systemic tongue mapping and how the tongue will show us different imbalances. She had a little bit of a white coating on her tongue, but the other thing that I noticed, she had a Malin Patty score of almost a 3-4. So I encouraged her to actually have a sleep study done and to actually have a conversation about what might be happening in her gallbladder. So when she returned to the office, she had actually followed up with her functional medicine doctor, and they had completed her sleep study and discovered that she had insomnia, plus she had AFib. At 34 years of age, most primary care doctors aren't going to be really looking at AFib as even a component. She knew that there was something there, but really just couldn't put her hand on it. So the sleep study really helped to open up doors of really helping her go down a path to better health. But the thing that was really interesting is that they found that her gallbladder is leaking. And it wasn't a conversation that they were even looking at. And so they were on a different path to really
Jeez.
try and help her. And so, what I say about systemic tongue mapping, I am not, we are not diagnosing anything for our patients, not a thing. We're just helping them understand that their tongue may be telling them something, that they need to have a deeper, more in depth conversation with their primary care doctors. So
Mhm.
when I'm looking at the tongue, I love the medical history of patients. And if we're not connecting the medical history and what we're seeing in the mouth, we're really not being as preventive as we could be for our patients. So in this particular patient, like I said, I knew that she was having some stuff. We had more conversations the first day about, how was her bowel movements? Was she constipated? What type of water was she drinking? Most people don't understand that dehydration plays a significant role in cardiovascular health, our sleep health, our diet health, how we uptake nutrients. The majority of people are extremely dehydrated. When we
Mm.
look at fissured tongue, again, we go, you have fissured tongue. And then we move on and, we might tell them, oh, you need to make sure that you're trying to brush your tongue and those types of things. So here's what I like to say about fissured tongue. Now, there's a couple of different things before I go down that path. 5% of the adult population has truly genetic, hereditary fissured tongue, and those are the ones that are
Oh,
really deep, really kind of throughout the whole tongue.
I've seen that before, and it's like you can hide stuff in there if you wanted to. Like those fissures are deep. So they were probably born with that.
There's a genetic component to it, and
Okay.
so oftentimes those are the patients that'll go, "Oh, I've had it all my life." It may not be showing that they have a hydration problem that's causing their fissuring, but we still want to have a hydration conversation with them
Mhm.
because it's hidden in those deep fissures. When you start looking at the tongue now and really evaluating, are there crack lines? Are there fissures? Oftentimes you'll find it right down the center of the tongue. Again, remember the center of the tongue is related to the stomach and the pancreatic and the spleen health. And all of our fluids are processed through our stomach. If we're not getting enough hydration, we're going to see that on the tongue as well. Probably 90% of the patients that I actually share that they have some cracking or fissuring in the tongue. And I say, ideally, you should be drinking half your body weight in ounces of water every day. They go, oh, you mean if I weigh 160 pounds, I should be drinking 80 ounces of water every day? And I'm like, yes. And they're like, oh, well, I know I don't drink that. There's a few
Yeah.
that I'll have that'll say, oh, I know I'm drinking 2 gallons of water every day. And what I suggest to them is that your body is still showing that you may have some signs of dehydration with these little crack lines. And I have patients' mirrors. I'm taking pictures of their tongue intraorally so that I can show them, so I can educate them, so that I can follow what's actually going on for them. Because it's really interesting as you have patients come back to you and you see things actually change based on the conversations that you've had with them in their previous appointments.
So you see that,
Mhm.
like, you see your patient one day, let them know maybe some stuff that's going on, they come back, and is it almost like a completely different tongue when they come in for their
It
next appointment?
depends, just like anything, if our patients actually follow up, if they do the
Yeah.
things at home. But, there are definitely a few cases that I've seen true impact when they've embraced the conversations that we've had. And like I said, the patients that feel like they drink a lot of water, I encourage them to go back and have a conversation with their primary care doctors. You can actually see dehydration in our blood panels, particularly in how the kidneys and stuff are functioning. Chronic kidney disease is one of the number one reasons why people end up in the hospital as seniors. It's oftentimes one of the chronic diseases that will lead to patients really having a lot of other chronic diseases as well. And when we think about the kidney, it's the thing that is cleansing our bodies of all of the toxins and everything that we're exposed to every single day. And if we're not hydrating well, then our kidneys aren't going to function as well.
Mm.
So anyway, patients that say they drink lots and lots of water, I encourage them to go back and have a deeper conversation about what's being seen in their blood. Is their blood showing that they're not hydrated well? A lot of times that's not a focus for primary care physicians, because if it's not a red flag in the blood panel, then it may be creeping up a little bit in the blood panel, but it's not, oh, this is an alarm kind of thing. It's not a conversation. So again, it's really
Yeah.
about helping our patients be better advocates for themselves. I tell the patient, ask about whether or not your blood is showing any dehydration. Are you missing some levels of electrolytes or nutrients that's not allowing your body to uptake that water, that hydration as well? Again, I'm not diagnosing anything. I'm just helping them
Yeah.
become better advocates for themselves when they go back to their primary care. I had a patient probably about 3 months ago who had had a liver transplant, and he had had some complications with his liver transplant. And it was interesting because left side of the tongue, there was a definite geographic tongue on that left side and not on his right side or anywhere else. And so what I shared with him was, I want you to see it today. I want you to look at it on a regular basis. If all of a sudden that area is starting to change or it's starting to get larger, more sensitive, if it's changing in color, that may be your initial warning sign that you have some imbalances. And you
Mm.
will want to go and talk with your nephrologist to make sure that your liver is still functioning the way that it's supposed to. There's definitely conversations that you can have with patients about what you're seeing so that they can advocate for themselves better.
We do that dance with dental stuff too. It's like, well, this looks suspicious, or when we see this, we usually do this, like we know what it is. We know it's a cavity. We just can't like diagnose it, right? So I feel like it's probably the same with the tongue. What this reminds me of is when I was back in hygiene school and we were learning about how to do oral cancer screenings. And it's like you have to learn what normal is first, what it looks like, what it feels like, and then you can recognize changes from that. So I'm assuming it's kind of the same with the tongue. And ideally, what is a healthy tongue? What does it look like? What does it feel like? What color is it?
So, a normal, healthy tongue is kind of a pale pink color. The shape of your tongue is that it really is not real thick. It moves and functions very normal, meaning patients can stick it out. They can put it to the roof of the mouth. They can put it to the side of their tongue. They can move it or to the side of their cheeks. They can actually stick it all the way out. Can't tell you how many patients, especially the older population, my age population, that have tongue ties. And I say, are you aware that you have a tongue tie? And they're like, no, what's that? And then we go down the rabbit hole of sleep and all of those types of things. So the tongue is kind of the guiding point. So color is pale, normal function, normal moisture on it. So a lot of us will see kind of those dry, withered tongues. And
Mhm.
withered tongues, you see them mostly in our senior population. You'll see them a lot with patients that have had cardiovascular issues or stroke issues because their body's just not functioning as well anymore. So, like I said, color, pale, shape, normal, fits into the tongue. It's not super flat. It's not super thick. thickening of the tongue can be a sign that there's a retention of fluids for patients, cardiovascular issues, and moisture.
Are there some really obvious conditions on the tongue that they'll stick their tongue out, you look at it and you're like, "Yeah, this patient is diabetic," or "This patient has high blood pressure." Like, are there some dead giveaways that you've seen?
So I had a patient who, and again, I haven't had enough patients really follow through per se to say, oh, yep, that's definitively, I can say that when I see this on a tongue that I'm suspicious of this. But certainly your diabetic patients, and, we have a significant population of patients that are undiagnosed diabetics. The coating on their tongues will typically be much thicker, almost like a greasy like appearance to it, have more of a
Mm,
yellow color. And what I've learned about coatings is that the thicker, the more yellowing, the more coloring that actually in it, the more rooted the systemic issue is, the more uncontrolled it actually is. So, gut health is probably one of the biggest things that you can really see on the tongue for patients. I don't know. Have you ever seen bald patches, Stephanie, in the very root of the tongue on your patients?
bald
Yeah,
patches?
sort of like a geographic tongue, but more bald patch in orientation.
I mean, not that I probably, but not that I'm recalling right now.
So I've had a few patients that have had that. One of them was a 24-year-old girl. And I started talking to her about things, and she goes, oh, well, I only have one kidney. And so I'm like, okay, well, that is the area of your kidney region when we start to look at the health of your systemic health. So you want to pay attention to this. If you only have one kidney, then it's going to show up if there's something going on with your kidneys in that region. It's really getting familiar with the map itself and starting to put the pieces together and having more conversations with patients. Don't be afraid to ask, what are your bowel movements like? Are they daily? Are they loose? Are they hard? Because it's really surprising when you start having that conversation with patients, what conversations they'll actually have with you about
Yeah.
truly what's going on with them systemically. When you were talking about really kind of getting a sense of what it looks like or your standard of what it looks like, you just
Mhm.
have to really start looking at tongues, and you just have to say, this is what a normal tongue looks like to me. Okay. This is
Yeah.
the color that I'm looking for. This is the type of coating that I'm looking for. This is the little red spots on the tongue. Those are, there's different meanings to those as well. Just a little side note here. I'm in the tail end of writing a guidebook for clinicians, and it'll have more in depth information about the different types of coatings and what you're looking for and what that can mean from a systemic standpoint. And so I'm hoping that it'll be a great reference for people to be able to flip to. Oh, what does this coating actually look like? What should I be asking
Yeah.
the patient? What should I be telling?
'Cause I've seen coatings, like, they're yellow, they're white, they're brown, they're almost black, like, they're thick or they I feel like I could, like, wipe them off. I'm really glad that you mentioned your guidebook because that was my next question. I was just gonna ask, like, where can people go if they wanna learn more about this?
So this was my gospel book in the beginning. It's just called Tongue Diagnosis in Chinese Medicine, and it's by Giovanni.
Okay.
I spent a lot of time in this book initially. And then I went into the differences with aromatic tongue.
Okay.
They're similar, but they have just a little bit different approach to it. This is called the Pocket Atlas to tongue diagnosis. And I kept this
Okay.
chairside. So if
Okay.
I had a tongue that I was like, "Oh my gosh, what is that? This is what the tongue looks like. What should I be asking? What might be happening?" So this was a great resource for me in the beginning. It helped me establish what was norm for me. The interesting part to me, Stephanie, is that the oral systemic link has been being talked about, truly talked about in the last probably 15, 20 years. But as I was doing research for my tongue presentation, I ran across this particular book. It's by Weston Price, and Weston Price is one of the founding fathers of holistic dentistry, really. And in this book, there is an excerpt of a presentation that was done by the original Dr. Charles Mayo. And he was addressing the Canadian Congress of Medical Physicians. And he basically, in 1916, said that there was an oral systemic connection and that 90% of deaths were going to occur because of simple focal infections that were going to be 90% from the oral cavity. And
Hmm.
in 1916, he said, we need to partner with our dental brothers. And yes, he said that we were brothers to really help care for our patients. So when I think about where we are over 100 years later, we need to intensify those conversations. And
Yeah.
our patients are truly ready to intensify those conversations, especially after COVID. I'm assuming that you found after COVID that there were a lot more questions from our patients.
Yeah, and they're definitely more curious. They're doing a lot of their own research or quote unquote research, which is good. Like I'm all about patients advocating for themselves. I've had my experiences with our healthcare system and no one is going to advocate for you. Like you have to do it yourself. It's not set up that way. It's interesting when you were talking earlier about asking patients about bowel movements. What patient is expecting to have that kind of conversation when they come into the dental office, But it's those conversations that's going to elevate us in the eyes of our patients so that they see us not as tooth drillers or scrapers or whatever, but really healthcare clinicians. And I think that's what we all want is to be seen that way because that's what we are.
Yeah. Well, and we are very blessed to be able to spend the amount of time that we have with our patients. And as much as we are there to be chairside, to have a really strong, good, healthy relationship with our patients, as a 39-year practicing hygienist, we are there as preventive specialists for them. And we need to start really getting comfortable with the conversations because unfortunately, the medical profession doesn't have the time. They have 7 to 10 minutes with the patient. And that 7 to 10 minutes is blah, 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 blah. And I'll see you next time. My husband and
Yep.
I were just having a conversation about this morning. And I said, when was the last time that your primary care doctor called and said, it's time for your yearly cystical? And he went, they never do.
Yeah.
And he said, and that's why, as practitioners in the oral cavity, we need to start having those conversations so that the patients can really go back and start asking for more preventative care from their primary care doctors. It's time for the shift, right?
Yeah. And I'm hoping that we're there. I mean, just when you were saying back in, what'd you say, 1916,
Mhm.
there was a conversation and it's still an uphill battle. And I'm just hoping, I don't know, I'm hoping that the tide is turning as far as that goes. But for like, if you notice something on the tongue and have a conversation with the patient, are you then reaching out yourself to their healthcare clinician? Like, how do those conversations go when you start talking about the tongue?
It totally depends on what I'm seeing. And of course, I'm using
Okay.
critical thinking, right? When I see stuff on the tongue, I immediately first, like I said, ask the patient permission. Are you open to a conversation about what I'm seeing on your tongue? And then I am immediately thinking, reflecting back, what was in their medical history? What did they tell me? What type of medications are they on? What other type of care providers might they be seeing besides a primary care doctor? It's a piece of puzzle kind of thing, right? The fun part is that if you ask the patient, can I reach out to your primary care doctor and just share what we've observed today? Are you comfortable with me sending them a message about what I have seen and something that may need to be looked at further. The patients that say yes, then I will send a little note to their primary care doctor. The interesting part about that is 99% of the time, you won't hear back from the primary care doctor. But what I say is the 1% that actually does respond back to you are the patients where you want to send your patients,
Yeah.
because that physician, that care provider is more concerned about what's going on in the patient's mouths and how it's affecting their overall health. So it's a great way for you to start building a back and forth referral. The hardest part is finding the time to be able to do it. Me personally, I just say it's more important for me to actually provide high quality care for the patient. And once you type out one, this is where Chat GPT will really help you in developing a template. Because if you talked more in their terms when you're reaching out to them versus in our dental terms, they are far more receptive to the information that you're sharing with them. So just, put into Chat GPT. I want to have a conversation with a primary care doctor about XYZ because of what I found on XYZ part of the tongue. And it is amazing what will come out of that. Now, do you use 100% of what Chat GPT shared with you? No, tweak it, put it in your own words, but it's a great place to make it much easier for you to develop that than if you're trying to do it yourself.
Always with that stuff, with images or even text. I mean, chat can make mistakes and sometimes they're very weird mistakes. And so you don't want to like take everything literally. But I know every experience I've had reaching out to the patient's orthopedic surgeon or cardiologist or whoever, I can't remember a bad experience.
Right.
They're like impressed that I'm reaching out and talking to them. They have no idea about their patient's oral health, but the majority of them understand how important it is. And they're just like, oh my God, like, thank you for telling me that they have periodontal disease. That's actually explaining why we can't get their blood sugar under control, you know? So it's just a matter of us really being brave and reaching out, and that's where the bridging of the gap is going to happen, is like taking these like one little step at a time and having these conversations one by one, and hopefully eventually we will get some momentum.
Yeah. Have you ever seen the movie Pocahontas?
It's
So
been a minute if I have seen it.
Pocahontas drops a rock in the river, right? And the ripple starts to flow. And so that's really what we're doing is we're
Mhm.
putting the beginning ripple into the river of the connection. But we have to be willing to do that. We have to be willing to do that for our patients. So I'm what they call a guest hygienist these days, and I have been doing that for about a year and a half. So I'm sure there's some of the people in your audience that are like, okay, well, she was in, because originally when I first started doing this, I was in a holistic practice. So it
Okay.
was fairly easy to have those conversations in the beginning. But as a guest hygienist, I have those conversations every single day. Don't think it's because I went down this path to become holistic biologic educated. This is the beginning of that path for your listeners. And just tell them to start observing and documenting what they're seeing. They don't have to have any conversations with the patient in the beginning.
Okay.
But if they start to look at it, start to formulate what their norm actually would look like, and they'll find the first patient that they are comfortable in having a conversation with about what they're seeing. So I like to say it's really about observation and documentation in the beginning.
That's what I was going to ask you, is like, what if someone wants to start, you know, implementing this into their appointment? How do they start? And I think slow and steady is probably the way to go, right? Is there a
Absolutely.
certain time that you do your assessment?
So my assessment is all incorporated into the oral cancer screening. It's really not taking up any more time. I have them, do the right, left, stick out your tongue. I grab a hold of the tongue And then I'm looking at it. If I'm seeing something that I think needs to have more conversation, I let go of the tongue and I say, "Are you open to a conversation about your tongue?" I take an intraoral picture and I hand them a mirror. I show them what I'm seeing. And then I put the mirror down and then I start my periodontal assessment. And once I get through the periodontal assessment, I'll share with them that during their appointment today, we're going to have a little bit more in depth conversation about what I was seeing and observing on my tongue. And they're like, "Oh, okay, sounds good to me," kind of thing. And it allows me to stay focused on the patient throughout the appointment.
Yeah.
Um, Instead of thinking, okay, how do I keep this conversation going? Did I ask them about their vacation? Did I ask them about their spring break? Did I ask them about their 4 kids? In a lot of ways, that's not really why they're there. They will answer those questions. And we think that's how we're building the rapport. And to a certain degree, that is. But the patients are amazed by the information that they get at the end of my appointments. I
I
primarily work
bet.
in the same temporary office now, and so I'm starting to see patients that I have seen, and it's kind of funny. The doctor says, "Okay, we need to start putting on the appointments that they want to see Lani so that we make sure that they get back with Lani." And when I'm sitting next to another clinician or a hygienist, can't tell you how many of them say, "I love sitting next to you because of the conversations and the things that I
Hmm.
learn based on what you're actually sharing with your patients." As Amanda Hill likes to say, remain curious, because when you remain curious, you become so much better as a clinician.
Yeah, and I mean, that goes for everything. I love that she says that. I think she's got a whole lecture on that, but especially, like, I've been talking to a few clinicians on my podcast in the recent weeks, and it's like, I just keep coming back to this concept that just because we were taught something in school, or just because we've been preaching something, I'll just say fluoride, for the last however many years, doesn't mean that we can't change our mind. It doesn't mean that we can evolve as the science evolves. And that kind of goes with this holistic dentistry as well. And with patients too, I mean, they will remember the appointment they had with their dental hygienist when she looked at their tongue or he looked at their tongue and then asked them about their bowel movements. They're going to remember that. And I think patients want to learn. Me as a patient, if somebody was looking at my mouth and was like, "Oh my gosh, we're learning so much about the tongue and what we can tell from the tongue. Is it okay if I talk to you about yours?" Like, who wouldn't say yes to that?
Right. I've never had a patient say no. So
Yeah,
I had a patient, I was, again, temporary. And I don't know. Have you ever guest hygienist, been a guest
I
hygienist?
have. Yeah,
So, for those of your listeners, if you've never been a guest hygienist, you've never probably really experienced this. Well, maybe you have. Just depends on your scenario. But you walk out to the reception area and you call Mr. Jones and you get that look.
deer in headlights,
You are
fear.
not my hygienist.
Yeah.
Where is Sally today? Well, Sally's not
Hmm.
here today, but I'm going to take really good care of you. Well, on this particular day, I went out and it was a 74-year-old patient, and I brought him back. And I was going through his medical history. He had a long list of medications. I did my assessment, asked him if I could have a conversation about his tongue. And he was like, "Well, sure, whatever." So throughout his appointment, we had lots of different conversations, talked about dry mouth, talked about what I was observing on his tongue, and some of the conversations that he needed to go back and have with his cardiologist and with his endocrinologist, because there was definitely some imbalances still for him. And at the end of the appointment, he said to me, "Never in all of my 74 years of coming to a dental office have I ever had this in depth a conversation about what was going on in my body because of what you saw in my mouth. Can I see you next time?" That's what we want our patients to leave with, right? We want them to be empowered, to be healthy, because when their body is healthy, their mouth is healthy.
Yeah.
It helps us to get out
Yep.
of that bloody prophy land. It helps them to really take ownership to what's actually happening.
Yeah, and it opens up these conversations that I bet you all of us want to have. Maybe we think we don't have the time or whatever, I don't know, but it's so much more fulfilling to practice this way holistically than just scraping the teeth and moving on to the next. So thank you so much, Lani, for all of your your knowledge. If somebody wants to reach out to you or learn more about you, what's the best place for that?
They can send me an email at oralwellnesslink@gmail.com, of course. They certainly can message me on Facebook, and I typically respond. Sometimes I'm traveling and don't have a lot of time to respond, but I usually get back to people relatively quickly. I am speaking at Under One Roof. I will be doing the 2 hour lecture or 2 hour presentation on the tongue at that event. But for hygienists here
Awesome.
in Colorado, I actually have been invited to speak at the Colorado Dental Hygiene Association meeting in November. So for those local people, and then if you're familiar with the Seattle Study Club Avery, I'll be doing a 1 hour webinar with them in November. So there's a couple of different places, and certainly watch the book's coming. I'm excited about it. It's going through its editing process right now. So it's well on the way. So follow me on Instagram, follow me on Facebook. Those are the two places that I will put stuff out there. So
Okay, awesome. Yeah, I'll make sure to put links to all of that in the show notes so people can find you. And then once that book too, Lani, is like ready to go and publish, just send me the link and I can put that into the show notes too for like new downloads. But that's, oh my gosh, that's so exciting. Thank you again for your time. And I hope that this is going to become just more of a mainstream thing that we're going to be talking about. So thank you.
yeah, you're very welcome. And I hope that your listeners find it fascinating enough to start observing and documenting with their patients. So,
Yep, they're probably really gonna start looking at tongues now, which is great, even more than we already do.
yeah.
So thank you everyone for listening, and we will see you next time.